This conference will now be recorded.
Good morning, students. Welcome to microbiology class. Today we are going to learn hospital-acquired infections. So, you all are familiar with hospital settings, right? You have attended hospital postings. So, what are these hospital-acquired infections? The very first requirement in a hospital is that it should not do sick no harm. What do you mean by this point? Any person who is healthy, who has entered the hospital, must return to himself, but should not do this. That is the very first one. So, the very first requirement in a hospital is that it should do the sick harm. Yes, the hospital, who usually come? The patient. Okay, and along with the patient, relatives also come. The patient must not become further sick in a hospital setting. At the same time, the healthy person also must not become infected. This is the first major requirement to be present in a hospital. Infection. What is infection? Definition: injurious contamination of body or parts of a body by bacteria, viruses, fungi, protozoa, rickettsia, or by the toxic substances produced by them. Infection may be localized or generalized. Okay, so infection means injury or contamination caused by bacteria, viruses, protozoa, or fungi to our healthy body. And this infection may be localized or generalized. If only a particular site is involved, it is known as localized. But if it spreads to entire parts of the body, then it is called as generalized. Next, what do you mean by hive or hospital-acquired infection? Hospital-acquired infection is also called nosocomial infection or healthcare-associated infection. So what are the other names of hospital-acquired infection? Nosocomial or healthcare-associated. The name nosocomial is derived from nosos, means disease, and comial means to take care of. It may be defined as infection acquired by a person in the hospital, manifestation of which may occur during hospitalization or after discharge from hospital. The person may be a patient or members of the hospital staff. So, nosocomial infection may be defined as an infection acquired by the patient as long as his stay is in the hospital or after being discharged from the hospital. Okay, so we can say that a person, a healthy person, went to a hospital to see his relative. He came back from hospital. After 2 or 3 days, he may get infection. So it may be a hospital-acquired infection. Or a healthy person came to meet his relatives, stayed that night with the relative itself because no one was there to take care of the patient. If that person has acquired some infection, maybe a cough, cold or fever, urinary tract infection or any type of infection, it's also a nosocomial infection. Understood? So what is a nosocomial infection or hospital-acquired infection? It is defined as an infection acquired by a person in the hospital, or manifestation of which may occur during hospitalization or after discharge from the hospital. The three main parameters of hospital-acquired infection: transmission of pathogens between patient and staff, presence of microorganisms in a hospital environment, and immunocompromised patients. These three factors are usually essential for hospital-acquired infection to take place. Means what? A microorganism must always be present in the hospital setting in order the hospital-acquired infection take place. Not only a microorganism, patients, persons, staff must also be present. Immunocompromised are more prone to acquire hospital-acquired infection. Next, nosocomial infection, changing microbiology. In different decades, the different microbials played an important role in the transmission of infectious diseases. In the mid-80s, Enterobacteriaceae, Staphylococcus aureus, and Pseudomonas aeruginosa. These three were the prominent microorganisms in hospital settings. Whereas in mid-90s, the role of Enterobacteriaceae has decreased, but the role of gram-positive cocci has increased. At the same time, many fungi as well as viral infections have increased. All microorganisms can cause nosocomial infection. There is no particular microorganism. There are a large number of organisms which can cause nosocomial infection, such as viruses, bacteria, fungi, and parasites. Next, bacteria. Among bacteria, we can again divide into gram-positive bacteria and gram-negative bacteria. Gram-positive bacteria, the predominant ones are Staphylococcus aureus and Staphylococcus epidermidis. These two are the most common gram-positive organisms encountered in hospital settings and responsible for hospital-acquired infections. Among gram-negative bacteria, Enterobacteriaceae. Which are the bacteria which are present in Enterobacteriaceae? Escherichia coli, Klebsiella, Proteus, Salmonella, Shigella, all of these will come under Enterobacteriaceae. Among these, Escherichia coli and Klebsiella are the most important Enterobacteriaceae bacteria which are encountered in hospital settings. Others are Pseudomonas aeruginosa, Acinetobacter baumannii, and Mycobacterium tuberculosis. Mycobacterium tuberculosis also comes under hospital-acquired infection. Many sick tuberculosis patients come from treatment there. If they are not protected properly, if they contaminate fomites. What do you mean by fomites? Any surfaces. It may be a door handle, even a chair where you can sit. Toilets, even the air that is present. All may be contaminated by tuberculosis bacilli from an infectious patient. So, Mycobacterium tuberculosis will also come under hospital-acquired bacteria. Next, viruses. Viruses such as hepatitis B virus, hepatitis C virus and HIV virus, rubella, varicella, and SARS virus. Fungi such as Candida, Aspergillus, all of these organisms are responsible for hospital-acquired infections. Next, what are the predisposing factors? First, hospital pathogens. The type of pathogens which are present is also dependent upon the rate of hospital-acquired infection. Next, poor hygiene. Usually, patients who are malnourished and have weak immunity are more prone to hospital-acquired infections than that of healthy persons. Overcrowdings. Yes, this is the most important fact. There should be a space between person to person in hospital settings also. Overcrowding is most common in outpatient settings. Therefore, you have to be very careful. Next, instrumentation and surgery. How do instrumentation and surgery act as predisposing factors? If we do not properly sterilize it, if we do not properly contaminate the surfaces, then the patient can acquire infection. If the surgical instruments are not clean, then that operation can become septic. Next, age. So age, very too young and very too old persons are more prone to acquire hospital-acquired infections. Why? Too young means their immunity is not completely developed. Too old because their immunity is thin. Next, burns. What happens if a person has burns? The superficial layer of the skin is damaged, right? As a result, the person is prone to contact any type of microorganisms very rapidly. Next, malignancy, transplantation, impaired defense mechanism. All of these are predisposing factors. Next one, mode of transmission. How does a person acquire hospital-acquired infection? First one is contact. That is the most common type of hospital-acquired infection. Next, airborne, oral, parenteral, and vector. First one, contact. Contact may be as direct or indirect. Direct means physical contact, that is by hands or by clothing. Next, direct contact followed by auto-inoculation and clinical equipment. The most important type of direct contact is by shaking hands as well as contaminated clothes. Yes, in a hospital settings, sometimes we usually touch the patient, right? We usually ask him to open his mouth or check his eyes. And we usually see the person's BP, everything. Okay, so we are usually coming into contact with the patient, not only the patient. After you examine the patient, you may accidentally touch yourself. Maybe you may touch your hand or touch your shirt or something. So the most important type of direct contact is by hands and clothing. Indirect type is by bedpans, bowls, jets, instruments like needles, dressings, and contaminated gloves. Airborne transmission by droplet respiratory secretions on surfaces and inhalation of infectious particles. Yes, in a hospital, we usually see sick people. Some will be coughing, some will be sneezing. No need of coughing or sneezing. If bacteria or virus is present in the mouth, even when they speak, they may usually be present in the air. As a result, another person get protected. Next, oral route. Parenteral. Parenteral means transmission and vector-borne. Vector-borne, flies, mosquitoes, rats, all of these are also responsible for spreading of the acquired infections. Our hospital are a balance of two forces. See this diagram. How is the picture? Doctors are there, patients are there, as well as bacteria is also there. Bacteria is always present in hospital settings. However clean you keep, however decontaminate you perform also, still some bacteria are always present because majority of the bacteria have become resistant to the common disinfectants which we use now. The risk of infection is always present. Patient can acquire infection before admission to the hospital. It is called as community acquired infection. Patient may get infected inside the hospital, then it is called as nosocomial infection. It includes infections not present or not incubating at admission. Infections that appear more than 48 hours after admission. Those acquired in the hospital that appear after discharge. Also, occupational infections among staff. So we have to be very careful. Okay, these hospital-acquired infections can further be divided into community and nosocomial infections. Hospital-acquired infections, we can usually keep ourselves as far as possible by decontaminating and disinfecting the surfaces and rooms and all the formats properly, because we cannot autoclave a patient. Right? Can we autoclave a patient? Can we sterilize a patient fully? No. Therefore, the best way is the amount of contamination in the electronic setting of the hospital is by decontaminating the settings. Next, healthcare associated infections. Healthcare associated infections are further divided into three types: exogenous, endogenous, and iatrogenic. What do you mean by exogenous? Patient's skin or mucosal flora, increased risk with devitalized tissue, fluid collection, edema, and altered binocular. Exogenous includes environment or instruments. May occur days to infect weeks following process. Most infections occur due to organisms implanted during process. So differentiate between exogenous and endogenous infections. What do you mean by exo and what do you mean by endo? Endogenous means it includes the patient's skin or mucosal flora. Exogenous means outer environment or instruments. Types of hospital-acquired infections. What are the different types of hospital-acquired infections? Urinary tract infections, surgical wound infections, lower respiratory infections, traumatic wound and burn infections, primary bacteremia, gastrointestinal infections, and central nervous system infections. Among these, the most important type of healthcare infections are urinary tract, surgical, wound, respiratory, and bloodstream infections. Urinary tract infections. Yes, this is the most important type of healthcare associated infections, which is the bacteria which is more responsible for causing urinary tract infection. Escherichia coli. Next, Klebsiella also. Next, which is the bacteria which is most commonly encountered in hospital setting? Staphylococcus aureus. So, it can also cause urinary tract infections. When you say hospital-acquired infection, when you get infected in hospital settings, right? Among this, the hands are the most important vehicles for transmission of hospital-acquired infections. The hands of the staff are the commonest vehicles by which microorganisms are transmitted between patients. Hand washing is accepted as the single most important measure of infection. Hands are the ones which play an important role in the transmission of infection. Therefore, properly washing and sanitizing your hands regularly is the single most important measure of preventing infections. Steps of hand washing. So, all of you have known this? Yes, you have learned. What is this? First one, rub palms together. Second one, rub the back of the palms. Next, interface finger and rub them. Next one, back of the fingers. Next, thumb. Next, fingertips and the middle. Next, not only the hand and the fingers, but also rub and both wrists also. Keep in the brain while hand washing. Don't forget to wash wrist also. Why hand washing is important? Can you see this? This is Makonki agar. If you have any doubt, this is an experiment. Okay? You place your hand palm on a Makonki agar and incubate it. After incubation, you can see bacterial growth. This is an example of saying that our hands are the most important factors and the prime ones which are responsible for spreading infections. Therefore, hand washing is a must. Hand washing. Proper hand washing is the single most important way to prevent and reduce infections. Wash and rinse hands for 15 seconds using a dry paper towel. Turn or faucet. Alcohol-based hand wash is also available in all patient care areas. Okay, we have known about hand washing. But why don't staff wash their hands always? Thanks to coronavirus that we are now, we all have become more hygienic. We are always using sanitizers as well as washing our hands, wearing masks. We are doing all this. But previously, why not? Even many doctors, nurses, and staff members do not always wash their hands. They may wash only when going and coming, that's all, maybe 2 times, but not after they come into contact with every patient. Why? First one, skin irritation. Yes, this is the first factor in accessible hand washing facilities. Next, wearing gloves. Next, too busy. Most important point, too busy. Next, lack of appropriate staff. Next, being a physician. Next, hand hygiene technique. We all have known this, right? So how do we use? We can use alcohol hand rub or by washing our hands for 10 to 15 seconds. Aseptic procedures 1 minute. Surgical wash 3 to 5 minutes. So here it is, surgical wash 3 to 5 minutes. Do you actually note the time during surgery? Do you actually note the time while hand washing? Yes or no? We don't know. But it is required to keep in brain to please follow the time required for hand washing for different processes. Prevention of hospital-acquired infections. How will you prevent hospital-acquired infection? Education of medical and nursing staff. Yes, we need to educate medical and nursing staff, not only these people, but each and every person who is working in a hospital setting. It may be a technician, it may be a helper also. All of them must be educated to protect themselves. Next, immunization. For many diseases, vaccines are present. So all have to be vaccinated properly. Aseptic and antiseptic procedure during and after surgery. Early recognition and isolation of infected patients. Avoiding overcrowding of patients in wards. Detection and treatment of carriers in patients and staffs. So what is this? Detection and treatment of carriers in patients and staffs. All the members who are working in the hospital must themselves get tested once in every 6 months, even though if they are healthy. All manner of tests have to be performed. All type of culture methods have to be performed. Even if the staff is healthy, they have to be checked once in every 6 months. Control. How do you control hospital-acquired infections? By organization of an infection control program. As with all other functions of a health organization facility, the ultimate responsibility for prevention and control of infection usually rests on the health administrator. The hospital administrator or head of the hospital should establish an infection control committee, which will in turn appoint an infection control team to provide adequate resources for effective functioning of infection control program. Every hospital needs a head and an administrator. This head or administrator must choose an infection control committee. Under this infection control committee, infection control team will be present. This team, what do they actually do? They usually go around the hospital, around the college, and they will see if the settings are clean or not, if all the areas are properly disinfected or not, if the OP wards are clean or not, if there is spacing and distances between patient and patient. Okay, so these are all the duties of infection control team. Reporting the matters. The committee must have a reporting relationship directly to either administration or the medical staff to promote program visibility and effectiveness. So what do this do? Infection control team is there. If they find any fault, they have to immediately report to infection control committee. This infection control committee can again report it to the medical staff or administrator. 5 pillars of infection control. What are the 5 pillars of infection control? First one, isolation and barrier control. Second one, decontamination of equipment. Third one, prudent use of antibiotics. Fourth one, hand washing. Fifth one, decontamination of environment. So these are the 5 pillars of infection control. Isolation and barrier control. What is isolation and barrier control? It's very sick patients have to be isolated properly. Okay. Second one is decontamination of equipment. All the equipments in the hospital setting must be sterilized and decontaminated properly. If not, they are prone to spread infection even to healthy persons. Next, prudent use of antibiotics. Why is this absolutely and foremost important? Antibiotics must not be misused. Only when there is a severe infection which cannot be controlled, antibiotics have to be prescribed. You cannot take for even each and simple infection an antibiotic. Why? If you take like that, you will become resistant. In our body, bacteria is there when we have some infection. The bacteria will become resistant to that infection. So we have to take antibiotics only under advice of doctor. Next, hand washing. This is the most important point. When you come to duty, you have to hand wash. When you come into contact with the patient, we have to hand wash. Example, you are entering a ward, a patient's ward. When you enter a patient's ward, you sanitize your hands and go. When you come out of the patient's ward, you again sanitize yours. Next, decontamination of the environment. Yes, we have to fumigate the rooms properly. So all of these are 5 pillars of infection control. Next one, infection control committee. The hospital infection control committee is charged with the responsibility for the planning, evaluation of evidence-based practice and implementation, prioritization, resource allocation of all matters related to infection control. So what's this? Every hospital must have an infection control committee. The infection control committee usually has to plan everything, and they will usually select a team. Maybe there will be up to 3-4 teams, because if it's a big hospital, a single team cannot go to the entire hospital, right? So 2-3 teams will be present. Each team will be allocated specific department or a specific area, they have to plan, they have to take notes. If there is any wrong, they have to immediately contact and report to the Infection Control Committee, which in turn reports it to the administration where necessary action can take place. Infection control team. Infection control team consists of about infection control doctor and infection control nurse. Role of infection control team: education and training, development and dissemination of infection control policy, monitoring and audit of hygiene and clinical audit. All of the members of the Infection Control Committee as well as Infection Control Team have to be trained in Infection Control Program. After that, they have to educate and train all the persons who are working in the hospital. Next, development and dissemination of infection control policies. They have to make policies of how to reduce infection. Monitoring and audit of hygiene. They have to maintain a regular monitoring of hygiene of both the patients as well as hospital staff. Clinical audit. We are all responsible in infection control. Yes, we all are responsible. Not only doctors, nurses, lab technicians, other technicians, even sweepers, ayahs, attenders, all of the members, all the persons who are working in a hospital setting, who are working in a hospital medical college, all of them are responsible in preventing infection. Okay. This is for our class. Thank you so much. I hope that you understood today's class. All of you, please maintain proper hygiene practices. Wash your hands, sanitize yourselves, use masks. Thank you.